Talk a little bit about the business group on health, what you're looking to achieve.
Rhode Island Business Group on Health now has 93 members representing about 82,000 people. We really strive to do a couple things. One, educate our members on healthcare issues in the state of Rhode Island. Two, represent the business community's point of view on healthcare in the state of Rhode Island. And three, try to advocate for a higher quality, lower cost healthcare system.
So as we talked about before you came out here, one of the big elephants in the room, and you talked about hospital mergers, what's going to happen with Care New England, and how concerned is the business community about this?
I think the business community is extremely concerned about this, both in terms of the financial viability of Care New England. It's obviously has some problems along the line, and the cost impact of Partners Healthcare potentially moving into this community. It is a very great concern, and it should be a concern for most people.
And we talked a little bit too about what should be done, especially from the state's perspective, in terms of bringing in the different stakeholders as this process moves forward. Again, we've heard some hesitancy from partners in recent weeks about the financial viability here of Care New England. But you talked about, stakeholders have been brought around the table before. It's sort of taking it to the next step. Talk with us about your experience in this arena.
Well, many years ago, I'm a retired hospital CEO. Many years ago, I worked in Rochester, New York, and we had an experiment that produced premiums that were 1/3 less than the national average. The state had a role in that it helped us to get in the room and use what are called safe harbors. But as an enabler, the state has a critical role. As a driver, I'm less impressed with that, frankly. So I think that the potential here in Rhode Island is for the state to function as an enabler, but for the business community to really try to drive the change. By the way, the experiment that I was involved in actually was driven by business, but done by the hospitals themselves. So I would advocate for a kind of less of a state hands-on approach and more of an enabling approach like we experienced in Rochester years ago.
And will you have state officials around the table at the summit this coming October?
There will be several state officials there. Senator Miller has been willing to come and dialogue with the business community. We think there are really a couple hot issues. Surprise billing is one. There is legislation right now at the State House. We don't know what happened yesterday with respect to the session, but Consumers Union has reviewed that legislation and is prepared to talk about how effective that is. And of course, the merger issue we think is really critical and will have a significant cost impact on the community.
And how much are you keeping an eye on what's going on in DC right now?
Well,
deep breath.
Yeah, deep breath. Well, I may be retired, but I have a lifelong interest in healthcare, so I follow that pretty closely. And I think what it says to me is we have a real opportunity to do something here in Rhode Island. I wouldn't count on the federal government doing anything genuinely effective.
And so you talk about who your membership is, who you're bringing around the table. Could you expand?
Well, we have been expanding. The primary focus of the business group has not been to drive membership, but our membership has been going up every year, and we obviously look forward to an increased membership. But I think that business's view is that we need to partner. So, for example, business community was very supportive of the work that the Rhode Island Foundation did several years ago with the Health Compact, and would continue to support and hopefully participate in those kinds of activities.
And so you mentioned one of the hot topics that you're going to discuss at the summit, the issue of surprise billing. What are the questions and what are you looking to seek to sort of get folks' input on about its impact on businesses?
Well, surprise billing is the phenomenon where the hospital may be in network and the attending surgeon may be in network, but another physician treating the patient is not. So in the case, there have been some examples here in Rhode Island where, and actually Rhode Island patients who were treated in New York City, where the attending surgeon charged 4 times what the surgeon, the assistant surgeon charged 4 times what the attending surgeon, and of course that comes as a surprise to the patient.
That's quite a surprise.
Therefore, the surprise billing. What we're looking for, that problem has occurred in Rhode Island, but it's not as prevalent as it is in New York City. So we think that this is a prime opportunity to pass legislation that would rein in those costs. Several of the bills being considered right now on Smith Hill are a little weak on that side, so we would hope that we would be able to use the influence of Consumers Union, which is doing work around the country advocating for physicians to be in-network, not out-of-network.
And the third issue, of one of many, but the ones that were highlighted when you highlighted the summit coming up, the issue of opioid abuse in the workplace affecting healthcare costs. How big of an issue is this?
It is a very big deal, and there is more getting to be known about what happened. For example, attorney generals from I think 40 states are now involved in looking at the opioid issue, what role the pharma companies played in quote-unquote false advertising. From the National Safety Council, in conjunction with the University of Chicago, has developed a cost estimator, and when we ran the numbers for Rhode Island, it turns out for a manufacturing company of $250, the cost of Rhode Island is the most expensive in New England. So we've asked the speaker from the National Safety Council to come and tell us what the costs are for the state of Rhode Island treating opioid abuse, and what can be done by employers to lower those costs.
Okay, so three of the hot topic issues, again, telling folks it's October 13th from 8 a.m. to 1 p.m. at the Providence Marriott. Al, what else do you want folks to know about the summit as they're considering, hey, this might be something I should go to?
Well, I think that what we've tried to do is run our summit. This is at least the fourth one that I've participated in since I've been working for the Rhode Island Business Group. We like to allow people to walk away with something, some idea of something they might try. We also want people to understand that the business community is very much involved in not only having a low cost, but it wants a high quality, accessible healthcare system. So we would hope that people would join us and learn something that they can take back to their business and their homes.
Again, it's Friday the 13th.
Ooh, I hadn't thought about that.
I was reading it. I did a little, Friday the 13th. But wanted to bring you in again, let folks know what the summit is all about. I expect we'll hear from you afterwards as to what folks discussed there, report back to the people, and clearly hear more from you when the new session comes up in January as to what's happening on Smith Hill.
Excellent.
Well, I'm glad I was able to have you in, having checked out Go Local before. Al Charbonneau, thank you so much.
Thank you very
I'll
much.
let you around the corner, and we'll talk soon.
Thank you.
Okay, thanks.
Bye-bye.
Al Charbonneau with the Rhode Island Business Group on health. They are having their upcoming annual summit on October 13th. This is from 8 a.m. to 1 p.m. at the Providence Marriott. Wanted to bring him in here in studio just to talk a little bit about what to expect at the summit, the issues that they're looking to cover. As he said, close to, I believe, over 80,000 members, representing 80,000 members are these businesses at the table. They are also going to have human resources professionals and consumers talking about hot topics in healthcare. Surprise billing, possible hospital mergers, of course, a big hot topic, and opioid abuse in the workplace. So appreciate Al taking his time to come in here, talk about the issues of importance to their members, and the summit coming up on Friday, October